Welcome to the final webinar in 2024 for the 1115 series that we've been organizing. Thank you once again for taking the time to join us this morning. I know it's holiday season and everybody's getting ready, so appreciate you being here. So today's webinar is focused on maximizing impact, the role of community engagement in the New York 1115 Medicaid Waiver. 11 a.m. We have an amazing panel and host here who's going to walk us through this discussion topic in a few minutes. To the final webinar. The agenda for today, we're going to get started with a brief introduction on who we are at Blooming Health. Thank you once again for taking the time to join us this morning. Co-founder and Chief Commercial Officer of Blooming Health. So appreciate you being here. Webinar series. So today's webinar is September. So we want to make sure everybody's aware who we are and engagement in the New York come up 15 Medicaid Waiver. So we are a technology company that started in New York City, and now we are growing across the country in 18 states. The agenda for today, we're going to get started with a brief introduction of who we are and by connecting them and to the community-based support sources, co-founder and Chief Commercial Officer of Blooming Health when they need it. We host this webinar series. It gives them access to the many public benefits and social care services. We've had that question come up a few times before. So we are a technology company with 900 plus community organizations, and now we are growing across the country. Work with different types of community organizations. Our mission is to power health equity for nutrition, transportation, housing, them, aging services, to the community-based all the way up to veterans and other types of Medicaid related support services as well. It gives them access to the many patient benefits, state level offices for aging and state level trusted community-based organizations. So the solution is focused on empowering community-based organizations and social workers and program managers, different types of community organizations where they are services in their preferred nutrition, transportation, housing, aging services, and we are all aware of all the way up to veterans and other types of Medicaid of technology divide or language barriers that limit a lot of large foundations and from knowing about the resources available to them and state level, and then also being able to access. So the solution is focused on empowering. So what Blooming Health is trying to do is to solve for this fragmentation, program managers making information more accessible members and where connecting them to trusted resource communication channel and language where they don't need to have all aware of the various barriers that they simply get a message from their technology divide or language barriers that limit or a lot of these underserved populations from knowing about the resources available to them and use this as a two-way communication channel that creates a digital tissue this fragmented system between the what Blooming Health is trying to do is to solve for this fragmentation by making information more accessible and connecting them to trusted resources. Build this digital tissue in the community, and then where they don't need to have internet further. They don't need to download accessibility in terms of message on their landline voice call, but then also to detect the messages or emails more proactively in different languages, so they can receive the support at their most vulnerable life situations and be connected to the necessary services when between the community-based members when they're already unfortunately living out of their car adults because they were evicted from a home. Our goal is to go before that, build this digital tissue in the community, prevent those situations and get connected to the local housing organizations so that they can get the support they need. Services, and then refer them to other community-based of the individuals in a streamlined manner where the members can receive the support at their most vulnerable life situations and for them, and be connected and then create the necessary services when we've heard a lot from other members when they've already got the help they needed, living out of their car with the services they were evicted and it changed their life. Our goal is to go before that and then integrate and report all of this, prevent those situations and get connected to the local housing organization so that they can we can track and follow the needs and then refer them to other community-based support services in a streamlined manner where the member is changing for different segments of the population happening to them and for them, and then create more transparent specifically in the 1115 waiver whether that individual actually got the help they needed, where they're satisfied with the services, and it changed their life circumstances that they're building, and then integrate and one of the primary goals in the waiver everybody's the whole spirit of this in terms of how is to ensure that we are making social care accessible and available to all populations regardless of how the needs are changing and want to make sure segments of the population culturally and linguistically competent and is delivered in a specifically in the 1115 waiver, we are here to help support the key challenges I've heard a lot from different CBOs to help scale the services that we are building, because that's one of the primary goals in the waiver is services. The whole spirit of this is to ensure that we are making social care accessible and available to all populations, is regardless of circumstances, and want to make sure it's accessible and culturally and linguistically competent, resources available to them, is delivered in a consumer-centric or member-centric manner where there's a lot of capacity building. And the key challenges I've heard a lot from different CBOs and SCNs is the difficulty, for example, in identifying who's eligible for what services, and then ensure that other technology, language, and trust barriers, and then how do we ensure that the members' experience is maintained as we launch this new waiver, and ensuring we are trying to again and support the information and the resources available to them and the benefits available to them. And then on the provider side, there's a lot of capacity building in a digital manner to ensure you connect that human services that you're already providing, those hard to reach populations, that the members are aware of these things that happen, and then ensure that technology, community health workers, barriers are solved for. And a referral was sent to the food pantry or the so that's information around when they are trying to receive a call from somebody else from the SCNs and CBOs with improving. So we are focused on increasing the reach, helping you with initial outreach, education, in a digital manner, expanding that helps you connect that human services that you're already providing, communications, and ensuring that the members are aware of points or in-person touch points after the encounters, and then notify the members, community health workers, or social workers, status of the services. That a referral was sent to the accessible manner via text, voice calls, and information around devices when they are different hours of the day from somebody else, in an inclusive way in their preferred language. So we are focused on increasing the reach and while maintaining the branding, education, and then the trusted relationship, expanding the capacity of the staff. So I'm going to pause here. We can help with the routine communications that happen after your virtual touch points or in-person touch points. Going to then shift and then notify the members, panelists, and the status for today. We're really excited to have Johanne voice calls and different types of devices series. So she's been leading our previous webinars as well. Thank you so much, Johanne, for your time today and for continuing to support us branding webinar series. Johanne Morne is the Executive Deputy Commissioner for the New York State Department of Health. So I'm going to hand over to you SCN partnerships we built.
Thank you so much, and good morning to everyone.
I'm going to then shift to introducing our panelists and hosts for today.
I've had the
really excited to have Johanne lead this fourth webinar in the series. So she's been leading our previous webinars as well. Thank you so much, Johanne, for your time today and for continuing to support us in this webinar series. Johanne Morne is the Executive Deputy Commissioner for the New York State Department of Health. So I'm going to hand over to you. Thank you.
Let me just Thank you so much, and good morning to everyone. First of all, really I want to make note that for New York State, these discussions, this is not I've had the pleasure of being in the discussion. We have had an 1115 waiver, and I look forward to many years. What is new, though, is the discussions and over the years, certainly the focus to prioritization, as we talk about the key areas of our focus. For those who may be joining for the first time or who may not have all the background as it relates to the 1115 waiver, what we have now is an 1115 waiver. First of all, that is I want to make amount that for New York State, this is not an 1115 waiver within the state is not new. The goal is to achieve a more equitable for many years integrated. What is new though is the focus, and while also increasing the focus to prioritization and measurable the key areas of care of quality focus have shifted and built upon each other. What do we intend to do? What do we anticipate is an 1115 waiver. First of all, supporting that is Medicaid hospital global budget $5 billion. Improving health equity and reducing health disparities is to achieve a more establishment of the social care networks, integrated we have spoken system, and while also increasing health equity, creating loan measurable programs for healthcare professionals, quality as a response to understanding that we have significant challenges. What do we intend to do? What do we anticipate? Establishing career paths. First of all, supporting programs, Medicaid and investing in budget initiatives, social care services, improving health as well as nutrition, health and housing support. The establishment of the social care networks, which we have
while the 1115
waiver
is
is
funded
funded
by
by
the federal
parts
government
of the series,
to state government,
creating loan repayment
this could
programs
not
for
be a
healthcare
success or
professionals
even advance in the
as a
way we
response to
anticipate if it
understanding
was
that
not
we
for the
have significant
partnership
challenges
that
and the
workforce.
stakeholders that we
Establishing
are able to
career
engage
paths
with
and
throughout
training
the entire
programs,
process, and investing in
I
behavioral
want
and
to
social care
make a point
services,
that
as well as
first of all, if
nutrition
you wanted to
and
see
housing
the
support.
previous
Sessions in the series.
So
If you
clearly,
would go to the
while the
Blooming Health
1115
website
waiver is funded
and,
by the
and
federal
also
government
underscore that for
to
today,
state
we
government,
are really focused and have the
this could
opportunity
not
to
be a
speak
success
with
or
two
even
dynamic
advance in the way
leaders
we anticipate
from
if it was not
community-based
for the
organizations,
partnership
so that we can
and the
also provide
stakeholders that
understanding
we
as
are
to the
able to
role that
engage with
community-based
throughout the entire
organizations or
process.
CBOs play.
I want
within the
to make a
1115
point
Medicaid
that,
waiver. First of all, if you wanted
I
to
also
see
want to
the
note from the
previous
beginning, and I'm sure
sessions
that
in the
we will
series,
continue to reference
if
this,
you would
but there
go
is
to
a
the
key
Blooming Health
resource
website
as it relates
and
to
also underscore
CBOs
that
and
for today,
participation
we
of
are really
CBOs.
focused and have
It's
the opportunity
state-produced,
to speak
and
with
it's
two
titled
dynamic
Social Care
leaders
Networks,
from
Introduction for
community-based organizations,
HRSN
so that
service
we can
providers.
also provide understanding
HRSN is a
as to the
health-related
role that
social
community-based
needs, and I believe
organizations or
through
CBOs
the course
play
of today's discussion,
within
we
the
will
1115
put that
Medicaid
link in the
waiver.
chat. I also
The
want to
guide
note
that I
from the
just
beginning, and I'm
referenced,
sure that we will continue to
was
reference
developed
this, but there
last
is a
month.
key resource
And
as it relates
really is intended
to
for
CBOs and
organizations that are
participation
providing
of
these
CBOs.
social needs
It's
services.
state-produced,
And
and it's
nutrition
titled Social
assistance,
Care
housing
Networks,
support,
Introduction
and/or
for
transportation.
HRSN service
For
providers.
community-based organizations that
HRSN is a
want to learn more
health-related social needs,
and provide
I
belief,
it can also provide an
through the
overview
course
of
of today's
Social Care
discussion,
Network
we
program
will
and
put
answer
that
some
link
of the
in the
basic or
chat.
frequently asked questions
The
that
guide that I
we've
just
received.
referenced was developed last
So,
month.
Let me take a
And
moment
it
and
really is
introduce
intended for
my colleagues
organizations
that
that
are
are on screen
providing
today
these
with
social
us.
needs services.
First, I'd like to introduce
and
Dorella
nutrition
Walters, the
assistance,
Chief Housing
business
Support
development
and/or
officer at God's Love We
transportation.
Deliver,
For
responsible
community-based
for client
organizations
outreach
that want
efforts
to learn
and
more,
establishing
and
community-based
provide.
and healthcare
It can also provide an
partnerships
overview of the Social
for the
Care
agency.
Network program and
Dorella
answer
is
some of the
focused on
basic or
supporting the
frequently asked
organization's delivery
questions
of more
that
than
we've received.
3.6 million nutritious,
So,
medically tailored,
let me take a moment and
high-quality
introduce
meals
my colleagues
to
that
more
are
than
on screen today with us.
12,000 individuals.
First, I'd like to
who
introduce
are
Dorella
impacted by
Walters, the
HIV
Chief
and AIDS,
Business Development
cancer,
Officer at
and
God's Love We
other
Deliver,
life-altering
responsible for
diseases
client
in New York
outreach
City,
efforts
as
and
well as in
establishing
surrounding
community-based and healthcare
Welcome.
partnerships for the agency.
Next, I would like to introduce
Dorella is
Dr. Marilyn
focused on
Fraser,
supporting the
Chief
organization's
Executive
delivery of
Officer
more
at
than
the Arthur Ashe
3.6
Institute for Urban Health,
million
the research
nutritious,
associate
medically
professor
tailored,
in both the Department of
high-quality
Medicine
meals
and the School
to
of
more
Public
than
Health at the SUNY
12,000
Downstate
individuals
Health Sciences
who
University,
are impacted by HIV
also the
and AIDS,
co-director of the
cancer,
Brooklyn Health
and
Disparities
other
Center.
life
Previously as Deputy
diseases in
Director
New York
and
City,
Associate Director
as well as in
for
surrounding
Research and
counties.
Training.
Welcome.
Dr. Fraser managed the Institute's community
Next, I would
outreach
like to
and
introduce
research
Dr. Marilyn Fraser, the
programs.
Chief
So
Executive
welcome
Officer
to both
at the
of you,
Arthur
and thank
Ashe
you
Institute
so much for
Urban
taking
Health,
time
the
today to
research
help us
associate
understand
professor
even more
in both the
the
Department
role
of
of
Medicine
community-based
and the School of
organizations
Public
in
Health
this
at the
really
SUNY
significant
Downstate
waiver program
Health Sciences
that is
University.
focused on
Also, the co-director of the
eliminating
Brooklyn Health
disparities.
Disparities
Thank
Center.
you both for your commitment
Previously
and
as
for
Deputy
joining us
Director and
today.
Associate Director for Research and Training.
Thank you.
Dr. Fraser managed the
Absolutely.
Institute's community
So
outreach
I'm going to
and
start. Well, I'm
research
going to pose a question to
programs.
both of you.
So welcome
And,
to both of
the
you, and
question
thank you
is,
so
as a
much for taking time
community-based
today to help
organization,
us understand even
Did you have
more
initial
the
concerns?
role of
Did you have initial
community-based
worries about
organizations in this
participating
really
in the
significant
1115
waiver program that is
process?
focused
If you did,
on
what were some of
eliminating
those concerns and
disparities.
how have they
Thank
been
you both
addressed?
for your commitment and for joining us today.
Well, I can start. I think at God's Love,
Thank you.
we were excited at the
Absolutely.
concept of it
So I'm going to start. Well,
because,
I'm going to
it was
pose a
going to
question to
impact
both
so
of
many
you.
lives.
And the
We
question is, as a
already
community-based
had an awareness
organization,
that we were serving a
did
number
you
of
have initial
Medicaid members,
concerns? Did you have initial
but then,
worries about
the waiver
participating in the
implies
1115
more
waiver
people. So
process?
I think
If
that
you
was kind
did,
of,
what
what
were
does
some
that
of those
mean?
concerns
How many
and
people
how have they
could it
been
possibly be,
addressed?
et cetera? So I think there was some,
Well, I can start.
kind
I
of,
think at God's Love,
not trepidation, but
we
just wondering,
were
we're excited at the
what would
concept
be
of
needed
it
to meet
because,
that
it was going to
population, right?
impact so many
But
lives.
then
Then understanding that it was going to
we
be an exciting opportunity for all these other
already had an
CBOs, and
awareness that we were
since we already
serving a
had a
number of
familiarity
Medicaid
with
members,
collaborating with each other,
but
then,
was going
you
to
know,
be a
the
strong
waiver
part of it, but
implies
handing it to
more
Marilyn.
people. So I think
Yeah,
that was
so
kind of,
as Dorella said,
what
it
does
was
that mean?
exciting to
How many people could it possibly be, et cetera. So I think there was some, you know, kind of not trepidation, but just wondering what would be needed to meet that population, right? But then understanding that it was going to be an exciting opportunity for all these other CBOs, and since we already had a familiarity with collaborating with each other, that was going to be a strong part of it. But handing it to Marilyn.
Concerned about certain things.
Yeah,
so
as Dorella said,
it was exciting that we serve. One of the things when community-based organizations screen their populations or serve populations, we do not screen them based on
and we
whether they
serve
have
a lot of
Medicaid or not.
community-based organizations,
Right, and so that was
a
a concern in
and
terms
as
of
part
who
of
would be
the
covered under the waiver, who
together
would
for
not
health
be
equity,
covered.
the consortium of
Thinking about
community-based
those
organizations that we
provisions
serve.
there.
And
They-
even thinking
those
about some of the
organizations and us,
uncertainties,
we were
when
concerned
asked
about
to
certain
sign
things,
on,
you know,
to
what
be
it
part of
means
social
in
care
terms of the
networks and so
populations
forth.
that we serve,
and
having
one of the
clarity
things when community-based
with what does that
organizations
really
screen their
mean.
populations,
And so some of our
serve
members,
populations,
when
we
we
do
think
not
about
screen
our
them based on
CTHE
whether they
members,
have
some are
Medicaid
concerned
or not. About
right? And so
signing
that
on
was
to
a
something
concern
that's
in terms
somewhat
of who would
blind,
be covered under the
in terms
waiver,
of
who
like
would
going
not
into
be
an
covered.
unknown.
Thinking
So
about those
that is another
provisions
concern. Thinking
there.
about the time
And even
frame
thinking about some of
of the waiver and what
uncertainties
can be
when
done
we're
in that
asked to
limited
sign
time
on to
frame
be part of social care networks
that we
forth.
have, and what does
and
that
having
mean
clarity
in terms of
with
the
what
needs
does that
of
really
the
mean. And
folks
so some of our
that
members,
need to
when we
have the
think about
services,
our
also the
CTHE
workforce
members,
that
some
has
are concerned
to be
about
mobilized for this
signing on to
waiver,
something
what
that's
happens then.
somewhat blind.
And is it
in terms
they're
of like going
having
into an unknown,
less
so
quality in
that
terms of
that
the,
is
the
another
work that they
concern.
have to
Thinking
do,
about the
it's
time
much more
frame
work, shorter period
of the waiver
time.
and what
so
can be done in
those
that
are some of the
limited time
initial
frame,
concerns that we have, although we know that
we
it is
have,
moving the
and
needle.
what does that mean
From
in
where we
terms
were
of
to the
to
needs
moving
of
in
the
folks
folks, as you
that
mentioned, all the
need
different
to have
things,
the
those
services,
things are important.
also the workforce,
and we know that, and we
that
recognize
has
that, but
to
they are
be
still
mobilized
for this waiver.
with
What
amounts
happens
our
then?
community members.
And is it they're
So,
having
and it certainly seems fair to have those
less
concerns,
quality
right?
in terms of the work
some
that
of
they
this
have
is
to do
that
because
we
it's
also
much
learn
more
and we
work,
gain
shorter
understanding
period
as we
of time.
advance and we
And
move
so there's
forward.
those are some of
really,
the
I
initial
appreciate,
concerns
though,
that we have, although we
the
know
comment that
that
was
it is
made that
moving the
from
needle
we
from where we
progressing,
were
right? So we went from a
moving
district
in a
model, and
path,
now we're
as you
in the
mentioned, all the
1115
different things.
health
Those things are
equity focused
important,
model,
and we know that,
which
and
I
we
think is
recognize that,
based
but
on
there
a
are
number
still
of things, but
concerns
most importantly, the
with
input
amounts of our
from those
community members.
individuals that are in the communities doing the
So,
work.
and it certainly
as
seems
to
fair
what
to have
the
those
true
concerns,
barriers
right?
are.
I mean,
And I want to
some
make
of this,
note, I think that
we
also
also
both
learn
of you and we gain
and the
understanding
organizations
as we
that you
advance and we
represent.
move forward.
There's
I
historic
really
expertise
appreciate
and experience here.
and the comment that was
most
made that
importantly,
trust
we are
within the
progressing, right? So we
community,
went from a district
which
model,
is
and now
a
we're in the
huge part of
1115
what will allow
health
this
equity
to
focused
be
model,
successful.
which I think
So,
is
thank you
based
for-
on a
thank
number
you
of
for
things,
that.
but most
And,
importantly,
certainly
the
as we
input
continue
from
to
those
move forward,
individuals that are
it
in
will
the
be interesting
communities
to
doing
know how
the
those
work
concerns are
as to
addressed,
what
which
the
I
true
know will
barriers
be
are.
evident through the
And I want to make
outcomes.
note, I think that
So,
for both of you,
you know,
and the organizations that you represent, there's
share this with
historic
Dorella, based
expertise
on
and
the guidance that you've
experience here,
received already
and
from the state.
most importantly,
And the SCM
trust
governance
within
boards
the
being
community,
required to,
which is
primarily
a huge part of what will
community-based
allow this to
organizations.
be successful.
How has that
So,
experience been?
thank you
Have
for
you
that.
felt
And
heard
certainly as we
along
continue to move
perhaps
forward,
larger entities
it will
that
be
may also
interesting
be
to know
present
how
at the
those
table?
concerns are addressed, which I
I
know
think
will
the
be
design
evidenced
that
through
the
the
state has
outcomes.
created
So,
is
I'm
really
going to start. I'm going to
a great framework
share this with you
because it
first, Dorella,
includes
based on
both
the guidance that
CBOs
you've
and
received already
Medicaid
from the state.
members. And
And
that
the
has
SCM
provided, at
governance
least for me, I
boards being
happen to be part
required
of the
to
governance
be composed
board for
primarily of
Public Health
community-based
Solutions, Whole U,
organizations.
NYC,
How
Social
has
Care
that
Network.
experience been?
And that has been
have
an
you felt
opportunity to
heard
both
along perhaps
see
larger entities that may also be
CBOs
present at the table?
representing other
I
CBOs that
think the
aren't at
design
the
that the
table
state has
and
created
always
is
speaking to,
really,
let's say, all of the dynamics that we
a
have
great
to
framework
consider and make
because
sure
it
that
includes both
social
CBOs
care network
and
considers.
Medicaid
But at the
members.
same time,
And
hearing
that has
from
provided, at least for
Medicaid
me, I
members
happen to be
about
part of the governance
how
board
messaging
for
needs to be more
Public Health
transparent,
Solutions,
how
Whole U,
services
NYC,
need to
Social
be
Care Network,
easily
and
accessible
that has been an
for all
opportunity to
kinds of
both
individuals.
see
I think that has allowed for very
CBOs
robust and candid
representing
conversations. Other CBOs that
and
aren't at the table table.
I
and
have
always
felt,
speaking
right,
to,
as a provider,
let's say,
that
all of the
that
dynamics
same
that we
kind
have
of
to consider
behavior
and
and
make sure
dynamic
that
is
that social
occurring
care
across
network
all of the other
considers.
social
But
care
at the
networks.
same time,
What
hearing
is going to
from
be interesting
Medicaid
is when the
members
work begins to
about
happen,
how
and
messaging needs
how
to be
do
more
those
transparent,
governance
how
boards
services need to be
speak quickly
easily accessible
to what is happening
for
on the
all
ground,
kinds
boots on
of
the ground.
individuals.
And
I
then
think
what
that
are
has
things that
allowed
social
for
care
very
network
robust and
leaderships
candid
might need to
conversations.
consider.
But
And
for right now, I think voices are
I
being
have
heard.
felt,
I
right,
think
as a
relationships
provider,
across
that
community-based
same
organizations
kind
that
of
already
behavior and
existed
dynamic
are
is occurring across
infused
all of the
in
other
those
social care
roots.
networks. They
What
have
is
to
going
be,
to be
because
interesting
is when the
you
work
can't
begins
just
to
think
happen,
that it's
and
going to be a certain
how
size
do those
organization that's
governance
going to be able to
boards
do the work. There's all kinds of
speak
organizations
quickly
that are
to what
part
is
of this
happening on the
intervention.
ground, boots on
They
the
have
ground.
been serving these
And then
communities
what
for
are
a long
things
time,
that
so
social
you
care
want to be
network leaderships
cognizant
might need to
of
consider.
making
But for right now,
all
I
of
think,
these,
let's
voices
say,
are
forms
being
and
heard. I
applications
think
and all of these other
relationships
processes
across community-based
accessible to
organizations
all of
that
these
already
organizations and
existed
making sure that they have the
are
time
infused
to
in
actively and
those
successfully
roots.
participate
They
in
have to
this.
be, because
That's my 2 cents.
you can't
Yeah,
just think
absolutely.
that it's
I
going
love
to
the
be a
fact that
certain
you
size
underscore
organization that's going
that
to be able to
individuals
do the
with
work.
lived
There's
experience
all
who are
kinds of
actually
organizations that
directly
are
impacted
part
by
of
the
this
decisions
intervention.
that
They
we as
have been
providers,
serving these
government
communities
officials,
for a long
whomever
time. So
make,
you want to be
have a
cognizant
clear voice in
of
the discussion.
making
Dr.
all of
Fraser?
these, let's say, forms and
Yes,
applications and all of these other
I think
processes accessible
I'll
to
step
all of
back
these
a little bit and
organizations and
think
making sure
about
that they have
our
the time
communities
to
that we serve
actively
and
and
the
successfully
community-based
participate in
organizations that are
this.
part of
That's my 2
CTHE.
cents.
And we
Yeah,
had a
absolutely.
conference
I
about
love
a
the
week
fact that
ago,
you
and we were
underscore
talking about
that
this, and we
individuals
met
with
with some of
lived
the
experience who are
SCNs
actually
and with all of them,
directly
and we
impacted by the
had panel
decisions
discussions and so
that we
forth.
as
And one
providers,
of the things
government officials, whomever
has been
make,
coming out, a
have a
recurring
clear voice
theme
in the
coming out of
discussion.
from
Dr.
that
Fraser?
body, from the consortium, Yes, is I as you've think said, Dorella, the I'll step transparency, back making a sure little that bit there and is think transparency, about making our sure that people's communities voices that are we heard. serve and the community-based And right organizations now, that are it's part of not, CTHE. we're not sure And we about had a what conference about a week what's the ago, and best we were way in talking about terms of this, that and we met with happening. some of the We know SCNs that the and with SCNs all of are them, integrated, and we had panel discussions and so forth. And one of the things that has been coming out, a recurring theme coming out of from that body, from the consortium, there is a process, as you've said, Dorella, the transparency, making sure that there is transparency, making sure that people's voices are heard.
Like having
And right now,
organization
it's
coming
we're
together
not
and say, okay,
sure about what
this is what we're hearing from
what's
the
the best
community,
way
and
in
this is
terms
what we
of
would
that
like
happening.
to have happen.
We know
And
that the
is not in
SCNs are
place as
integrated,
yet,
but
their
that's
mandate
what
is
community-based
to have a
organizations
certain number
are
of
saying that they would like to
CBOs
have
there,
a lead
and
organization
at the
that
same
would
time,
reflect
we want
the
to make
voices
sure
of the
that
community and
there
or
is
lead
a
entity
process
to
on the
reflect the
CBO
voices of the
side
community.
to channel
Because
what those
there
things
are so
are,
many uncertainties with
our
having
voices,
three
like
SCNs
having
and
one
not
one
sure how those
organization
things will be
coming together and
integrated.
say,
If
okay,
there's a
this is
client
what
that
we're hearing from the
straddles
community, and
both
this is what we would
groups,
like to have
both
happen.
areas,
And that is
they're
not in
dealing
place
with different
yet,
care
but
coordination
that's what
systems.
community-based
All of those
organizations
kinds of
are saying
things
that they would
are
like to
still
have a
there,
lead
and we want to
organization
make
that
sure that
would
community
reflect
voices
the voices
are
of the
integrated in the
community
process,
or lead
and
entity
they are
to reflect
heard,
the voices
and
of the
those
community.
concerns are
Because
heard. So
there's so
at
many
this
uncertainties
point,
with
I
having
still
three
think that there's
SCNs
work to
and
be
not
done, of
sure
course,
how
because
those
it's
things will
new
be
to all of
integrated.
us.
If there's
But
and I'm
client
hopeful
that
that would happen
straddles
as we have these
groups,
discussions, as
both
we're having
areas,
the discussion
and
that we're
they're
having
dealing
right
with
now,
different care
that
coordination
others would
systems.
think about
All of those
ways
kinds
in
of
which we
things
can better
are
integrate the
still
system,
there,
ways
and
in
we
which
want
we
to
can
make
be
sure
more
that community
transparent
voices
and,
are
with each other,
integrated
because
in the
as you
process,
said,
and they are
the
heard,
trust
and
is
those
a big
concerns are
issue,
heard.
right?
So,
And if
so at
we
this point,
dismantle
I
trust,
still think that
then
there's
it
work to
becomes
be done,
harder
of
for
course,
us to
because
really
it's
do the
new
work
to
that we
all of
need to
us.
do.
But and I'm hopeful
That's
that
right.
would
That's
happen
right.
as we have
And
these
so I
discussions,
appreciate
as
again,
we're
just
having the
underscoring
discussion that we're having right now,
how
that
essential it
others
is to have
would think
community
about
voice in this
ways in
discussion.
which we can better
And
integrate the
then care
system,
coordination, because
ways
part
in
of
which
what
we
I'm
can
hearing you
be
say
more
too is that,
transparent
let's take the
with each
lessons
other, because
learned,
as
and
you
we know
said,
that there are
Johanne,
ways in
the
which we can
trust
make our
is a
existing
big
systems and
issue,
network
right?
of
And if
systems more
we dismantle trust,
for the
then it
individual and
becomes
also
harder for
for
us to
the
really
staff
do the
that
work that we need to
that are
do.
leading these services and actually have
That's
the
right.
boots on the
That's
ground.
right.
And so I appreciate again,
That's
just
great.
underscoring
That's great.
how
This is for
essential
both
it
of
is
you.
to have community
And so
voice
the
in this
question I
discussion.
have is, will your
And
organization
then
be doing
coordination,
any
'cause
sort
part
of
of what I'm
outreach or
hearing you say
education
too is that,
as part
let's
of the
take the lessons
1115
learned waiver. And we know that there are ways in which we can make our existing systems and network of systems your specific lead entity as far as for the individual, and also for the staff that are
You want to go first, Marilyn?
These services and actually have
I could go. I could go first. So
that's great.
Looking at it from the Arthur Ashe Institute
this is
perspective,
for both of you.
And we do a lot of the outreach and a lot of coordination. Also, a lot of screening. We have gone into communities and done. And we continue to do this screenings for social determinants of health within our community venues and linking people to care and so forth. And then on a more macro
want to go first,
level, as I could go. I could go first. Conducting trainings, and we do convene trainings with our community-based organizations. And it's not necessarily a lot of the outreach and a lot of coordination. These are things that a lot of we have done and we'll continue to do. So communities from the community side, continue to do this, right? For social determinants of health within our community venues, inform the work that the SCNs will lay out and so forth to be done. And then on a more macro level, there too. So there is we will be conducting screenings, trainings, and we do convene trainings with our community-based organizations. Trainings will continue, and it's not necessarily owned by the SCNs per se. These are things that we have done and we'll continue to do. So coming from the community side up,
and for us,
and thinking about
God's
how
love,
does that
I
inform the work that the
social
SCNs
care
will lay out
networks
to be
have
done,
the messaging
and
or
that
the most
coordination
up-to-date,
there
let's
too.
say,
So there
from
is
the
outreach
Department of Health
and
and
screenings
kind of
and
what
those things, navigation that will
nuances
continue to
will
happen.
be
Trainings
happening
will
right in the
continue to
waiver.
happen, and
But
we'll
we
be
are very
informed as
aware
well,
that there are going
with
to
that
be lots of
bidirectionality
new
when we're speaking
CBOs,
to
for lack of a better
SCNs and so
description,
forth.
that will be providing
And
services.
for us,
And
at God's love,
it's important for them to both
the social
know
care
what
networks
we do
as
have
a service,
the messaging,
but then
or
also
the
for
most
us to learn the nuances of their work
from
as
this
well.
Why?
Department
Because
of Health
and kind of what
Medicaid members will not always
nuances
stay on the waiver.
will be
right?
happening
There's life
right in the
after
waiver for some of
But
these Medicaid
we are very
members.
aware
So
that there are
we
going
want
to
to
be
make
lots
sure
of
that
new
we're
CBOs,
building
for lack of a better
relationship
description,
with
the
will be
community-based
providing
organizations in
services,
each of the
and
SCNs.
and some
It's
of the
important
SCN
for them
leaderships,
to
right,
both
are helping to cultivate that
know
in
what
different
we
ways.
do,
Creating
as a
meet and
service,
greets
but
and
then
office
also for
hours
us
and
to
things
learn
like
the
that.
nuances
Of
of their
course, they're
work as
talking
well.
about
Why? Because
the website
Medicaid
that will
members
be
will not
listing
always
all of the
stay on the waiver,
organizations and the work
right?
that each
There's
one
life
does.
after the
But
waiver for some of these
success is
Medicaid
always about
members.
relationship building and
So
the
we
trust
want
that
to
Marilyn
make
was talking
sure
about
that
earlier.
we're
It's trust
building
across these
relationship
organizations
with
it's trust,
the community-based
working with
organizations
the
in
social
each of
care
the
network
SCNs.
staff
And some of the
and its
SCN
leaderships, but then right,
also
are helping to cultivate that
builds
in
trust
different ways.
for these Medicaid
Creating
members
meet and
that will all
greets
be
and
serving.
office hours and things like
Because
that.
they'll
Of course, they're
trust,
talking
you're
about
navigating me to this other
the
organization.
website that will
Do
be
you know,
listing all of the
how it will
organizations
work?
and the
then,
work that each one
staff,
does. Line staff will
but
be able to describe that.
success is
So I think
always
that's
about
really
relationship
important.
building and the trust that
So we'll
Marilyn was
probably
talking
see
about
lots
earlier.
more of
So it's
different
trust
kinds of
across
outreach
these organizations.
once the
It's
waiver
trust,
kind of comes online,
working with
in
the
social
January.
care network staff
I
and
think.
and
That's
its
my
leadership, but then also that builds
I mean,
trust
certainly what you're
for
talking
these
about, and
Medicaid members that
sustainability,
will
right?
all
So
be serving.
sustainability is
Because
absolutely essential as
they'll
it relates to
trust,
services.
oh, you're navigating me to this other
when referenced
organization.
earlier around, how long
Do
it
you
takes
know,
to recover
how it will
from
work? And then,
a
staff,
space of
line staff will be
distrust.
able to describe
I
that.
think that
So
we
I think that's
know
really
when
important.
individuals
So we'll
come
probably
to
see
have
lots more
expectation
of
of us,
different kinds of
we
outreach
want to make sure
once
that we
the
have the
waiver kind of
opportunity
comes
and the way
online
in which we
later
can
in
continue to move
January.
forward,
I think.
providing
That's my
historic
hope.
services, as both your organizations have done for so many
I mean,
years.
certainly what you're talking about is sustainability, right? So sustainability is absolutely
the
essential as it
other
relates
part
to
of that
services.
too is
when
thinking
referenced
about,
earlier
how do
around,
we address
how long it
emerging
takes
issues
to recover
right?
from
As we go forward,
a space of
and recognizing
distrust.
that
What may
I
be
think
in
that
front
we
of us
know
today is a
when
challenge for the
individuals
we
come
serve
to have expectation
will
of
continue
us.
to emerge
We
and
want
to
to make sure that we
transition.
have the
So
opportunity
how
and
do
the way
we
in which we
how
can
do we
continue to move
become
forward,
able enough to
providing
pivot,
historic
right,
services, as
within
both your
the
organizations have
framework
done for so
that we
many
have
years.
here?
Especially when you talk about
the
issues
other
of health equity,
part of that too
is thinking about how do we
disparities.
address emerging
So
issues.
we know that equity
right?
is a big
as we go
discussion
forward,
item,
and it was
recognizing
certainly a
that
key
what may
point
be in front of us today
is a
our-
challenge for the
our
individuals
last
we
series
serve.
and the webinar that was held last
Will
month.
continue to emerge
How
and
do
to
you see
transition.
that
So how
as
do we
principle or
how do we
foundational
become
as
able
far
enough
as playing
to
out
pivot
in the services
right,
that you
within
provide to
the
eligible
framework
individuals?
that we have here?
especially when you talk
Want to go
about
first, Marilyn?
issues of health equity.
Yeah, either way,
and
it's fine.
and
Yeah, I think
disparities.
when
So
we
we
think
know
of
that
the
equity is a
system
big
that's
discussion
not
item,
equitable,
and it
right?
was certainly a
in
key
in a
point
sense, we hope
our
to dismantle
last
a
series in the
system that's
webinar that was
already
held last
built
month.
on
How do
inequities.
you see
And
that
with
as
this waiver,
principal or
I think
foundational
as
as
I
far as
started
playing
out as
out
saying
in the
that we are
services that you
progressing
provide to eligible
and we are trying
individuals?
to bring equitable care to
Want to go
Medicaid
first, Marilyn?
members and making sure that yeah, either way, it's because fine. you have Medicaid, yeah, I think your services shouldn't be when we less think of than the system that that's someone not that has private insurance, right? for instance, in a sense, we're trying to do this hope and to making sure that dismantle we a have system that's optimum already health for built on all people. inequities. I think the equity with issue this waiver for us and for a lot of the as I community-based started out as organizations saying are that those people that are not included, and we are trying to right in this bring waiver, although it is, as equitable I said, care to it is Medicaid progress members and is a and move making forward. sure that But we serve populations because you have that Medicaid, are your your services services shouldn't be we serve less populations than that are undocumented. someone We've that had has private large insurance, for migrants, instance, and we're trying to do this population and within making sure our that communities we have optimum health for all if we are people. trying to I think the equity with those issue populations for to us seek and for a health lot and of the get better community-based health organizations care, are those and that then those they are people not that are not included in something right then in there this is the waiver, although it is, as I said, right, that we it have is to progress think and about. is a move And forward. so when we think But about we the serve equity populations issue, I think that it's are on different levels, equity, uninsured, we serve across populations that are the undocumented. population We've that the had waiver is large designed to migrants to serve, making sure that they have within our care, communities, both and being on and if we are Medicaid trying versus people to that are may work have with those private populations insurance, to seek but health also and get thinking better about health the inequity that may and be then created they are with not included having in something, a group then there is the that inequity that there needs too, health care, right? That may we not have be to think included, about, right? And so when we how think do about we the stretch equity the issue, I dollars think for it's the on community-based different organizations, levels, our direct equity service providers, across how do you stretch the population the dollars that to the make waiver is sure that designed you're serving everyone, making sure because that when they you have see equitable a community care, member, you're not both seeing being Medicaid versus non-Medicaid or anything. may You're have seeing private a person insurance in front of you, a but human also being, thinking and you about want to be the equitable, inequity and you want to make sure that with you're not providing the having best care group possible to that that needs individual healthcare that so may I not be think included, right? the equity issue how is a do we large one, stretch the and dollars it's for the couched community-based in a system organizations, that's our not direct service equitable. providers. How do you stretch we're trying the to dollars to dismantle make that. sure that you're
Agreed,
serving
Marilyn.
everyone?
And I
when
do
you
think
see
that,
a community member, you're not
tying
seeing
to what you were
Medicaid
saying,
versus
right? Some of the
non-Medicaid
services
or
within the
anything. You're seeing a
waiver are for
person
a
in front of
limited
you, a
amount of
human
time,
being,
right?
and you want to
At
be
least the
equitable,
furthest
and you want to
point
make sure
perhaps
that
might be
you're providing
12
the
months
best
worth
care
of a
possible
particular
to
intervention
that
if it's a high,
individual. So
a
I
health
think
related social need that's
the
being
equity issue
provided.
is a large
And
one, and it's
the thing to keep
couched
in
in a
mind is
system
that
that's
it is
not
community-based
equitable.
organizations that are
and we're trying to
that
dismantle
are
that.
in the
Agreed, Marilyn. And I
community
do
or
think
in the
that,
atmosphere once that
tying
person
to what you
kind
were
of
saying,
like ends
right?
that service.
Some of the
And for
services
some
within the
people, it will
waiver
be
are
falling
for a
off of a
limited amount of
cliff.
time, right?
So
at least the
from a
furthest
perspective
point
of
perhaps might
equity,
be, right?
12
Like,
months
how
worth
do
of a
we
particular
as
intervention, if it's a high,
all New Yorkers,
a
right,
health-related social
participating in the
need that's
waiver,
being
how do
provided.
we
And
anticipate that?
the
How
thing
do
to
we
keep in
prepare for
mind is
that
that
so
it is
people
community-based
can get the same
organizations that
services
are
as Marilyn was saying,
that are
kind of
in
be still supported
and
the
moving them
community or in the
hopefully,
atmosphere,
if that is their trajectory,
once that person
to whatever
kind of,
improved health
like,
status
ends
they
that
can kind of
service.
reach,
And
right?
for some
Whatever that
people, it
looks
will
like
be
for them.
falling off of a cliff.
But so
That's the key
from a
piece.
perspective
We
of
can't
equity,
let,
right?
like, how do we as a
what happens after
all
the
New
waiver,
Yorkers,
right?
right,
For a
participating in
person's
the
time or
waiver, how do
intervention
we
there,
anticipate that? How do we
like,
prepare
fall
for
off
that
and
so
then
that people
they
can get the same
end
services
up with
as Marilyn was
additional
saying,
illnesses again,
kind of be
simply
still
because they're not
supported
within that
and
waiver
moving
intervention.
them, hopefully,
So that's
if
why
that is their
it's
trajectory,
important to
to
really
whatever
support
improved
and
health status
strengthen
they can kind of
strong
reach, right?
partnerships
Whatever that
across
looks
those
like for
community-based
them.
organizations,
But
as well as clinical
that's the key
providers,
piece.
the
We
whole
can't
network, to make
let,
sure that no one kind of falls through the cracks.
what happens after the waiver,
And that's the
right?
concern.
For a person's
Are there going
time
to
or
be
intervention
cracks
there
for some
to
individuals?
just,
We don't
like,
want
fall
that. So how
off
do we
and
make
then
sure that we can prevent that? And the only way
end up with
that can
additional
happen
illnesses
is
again,
if everyone is working
simply because
together
they're not within that
synergistically.
waiver intervention.
So that's the
So that's
platforms. That's
why
the
it's important to
normal
really
interaction
support and
across those
strengthen
organizations.
strong
So that
partnerships across those
it's
community-based
warm handoffs,
organizations,
closed loop referrals, all clinical providers, the whole network, to make sure that no one kind of of falls through the
So
cracks.
it's building on the historic.
And that's the concern. Are there going to be cracks for some individuals?
that
We don't want that. So how do we make sure that we can prevent that?
And at the
the
same
only
time,
way
looking
that
for
that
the
can
ways in which we
happen is
advance,
if everyone is
considering
working
that,
together synergistically.
there's a
So that's the
considerable,
platforms. That's the normal interaction across
investment,
those organizations.
right? There's a
So
considerable
that
investment here.
it's
as we
warm
look at how
handoffs, closed loop
this
referrals, all
1115
of those
waiver
phrases that
moves
we're all
forward.
familiar with.
So I want to take one of the questions that had come in.
So it's building on the
it aligns with this conversation. So as a community-based organization servicing a high population
to work,
who is
and
either
at the same time
uninsured
looking
or
for the ways in which we
underinsured,
advance, considering
how
that
can
there's a
our colleague
considerable,
utilize the 1115 waiver program to continue supporting constituents,
right?
but
There's a
also
considerable
increase
investment
revenue
here as we look at how
to improve
this
service.
1115 waiver moves
Any
forward.
words of wisdom? So I want to take one of the questions that had come in because I think it aligns with this conversation.
Yeah, that's
So as a community-based organization servicing a high population,
that's a very,
who
very
is
good
either
question, and
uninsured
it's something
or
that I think
underinsured,
even
how
as a community-based
our colleague
organization, the
utilize the
institute is not a
1115
direct
waiver
service
program to
provider,
continue supporting
and the community-based
constituents,
organizations that
but
we
also
work with
increase
that
revenue
that's
to
something
improve
that people are
service.
grappling with,
Any
and
words of
and at the
wisdom?
same time, it's looking at what your mission is and keeping true to the mission, and seeing the 1115 waiver as something that would supplement the work that we're doing, and still raising funds to serve the population that we've already as a community-based organization. The institute is not a direct service provider, and continuing the community-based organizations that we work with that's something that people are grappling with, the social determinants and at the same time, that doesn't go away. It's not going to go away. What your mission is and keeping after the waiver to the mission, and it's still going to be here and at seeing the 1115 waiver as something that would supplement the work that we're doing, and still raising funds to serve the population that we've always supplemental funds for that, making sure that we're still doing that and continuing to promote health, continue to serve get additional dollars to serve the population and need the social determinants of health. I know there are a lot of concerns, and that doesn't go away. It's not going to go away when we think about after where we are now, and it's still going to be here at the same time. And what happens so I think the waiver in January, should be seen right? The waiver is a supplement coming out. We're starting our work in January, and then we're in a new population supplemental funds for that. And so those are concerns that we have even for funding. What funding would look like for the get additional dollars to serve the populations. And I think it's really working. I know there are a lot of concerns. I know Dorella, you talked about the networking. There are a lot of concerns when we think about here where we are now. The advocacy in the political climate and what happens organizations in January, will be important. Right, the waiver is gain coming out. We're starting our work in January, but also for us to garner support. And so those are concerns that we have even for funding, advocating on behalf of ourselves, but doing it together. I think we're just stronger and I together as really working together versus going out individually to networking. So I see the waiver as a supplement will be important. And I think the advocacy amongst community-based organizations will be important, even and working together in a collaboration to move the needle forward. But also for us to garner support.
Agreed.
And
I think
for the importance of the work that we are doing. So
for community-based organizations
on behalf of ourselves, but doing it together, I think we're just stronger
understand
together as
that the waiver, the revenue that
versus
it's going to
out
potentially bring into an organization.
So I see the waiver as a supplement.
Is a signiquant
still need to
quote
be
unquote
true to the mission that
miracle.
we have.
It's a holiday miracle, right? And you're going to be leveraging that
in a collaboration.
Be cognizant of how you operate. Be cognizant of, I think, the fact going to be nothing in life is for community-based organizations. Then strategize for your organization to also understand, as Marilyn's saying, that to make sure you can serve the revenue that it's going to potentially bring into an organization eligible for the waivers, services. is a significant quote unquote concept of advocacy. It's a holiday miracle, really looking right? And you're going to be organizations go into grant opportunities together. Be cognizant of how you operate. To do research opportunities together. Be cognizant of because the fact that opportunity that the waiver will provide. So how do you then strategize for your organization to also, as Marilyn's saying, to make sure you can serve what individuals are the impacts that aren't necessarily going to be eligible as a result of all of this innovation that's coming in through the waiver. So how can CBOs, the concept of advocacy, the concept single organizations or collaboratively, can organizations start go into grant opportunities together, story and that narrative, start to do research foundations and corporations, and because federal funding, state opportunity that the waiver will provide touching specific populations. This is going to be a big kind of what revenue is always going to be in terms of what are the impacts that can. So how do you continue as a result of all of this innovation that's coming in? Demonstrate both return on investment to the state, but then also return on investment. Single organizations or collaboratively really start to as they're talking to quote unquote story new and that narrative without both foundations and corporations and considered before federal funding, for, state funding, now you can start innovative ways that because you participated in this new thing called the 1115 waiver. Yes, revenue is always going to be kind of this thing that CBOs are concentrating on. So how do you continue that look like this? And you have to demonstrate both return on investment to the state, but then also return on investment to that can be a story for a CBO as they're talking to quote unquote new interested parties.
As it relates
grant
to
that you've never
this waiver
considered before applying for, but now you can start to talk about that because you've participated in this new thing called the 1115 waiver.
Perspective,
you've done new things.
And
you've been able to see
outcomes
patients started at baseline and
the
improvement looked like this by the end of 6
assist
months.
individuals,
and that's going to be transformative. You just have to kind of pay attention to that.
This is great. Now, in both your responses, you talk about network and you talk about as it relates to there are many providers, right? It's allowing and creating the space. And so I think one of our colleagues here raises a fair point, and I'd be interested in your feedback. So certainly, our colleague is with the Office of the Aging on and the ability. What's written here is we already offer services that help support older adults and others through the NWD. This is great. Now, how do we? In both your responses, you talk about network and you talk about in this as it seems like a duplication. There are many providers, right? Many of the services already being provided. And so I think one of our colleagues here raises a fair point, and I'd be interested in your feedback.
So I have the feeling that there are these moments where the innovative services of the waiver
that help support older adults and others through the NWD
other service interventions. But keep in mind, let's say, if it's for a Medicare population or, area on aging funding, right? Like that's going to be based on age, but not necessarily on the other eligibility criteria that fits into the waiver. I have the feeling that there's the opportunity moments to where service interventions, innovative services of the waiver, if it is that one parallel stream allows for food and nutrition other service interventions. But keep in mind, let's say, if it's for a Medicare population or, is area on aging funding, housing support, right? Like that's going to be supplies based on age, but not necessarily on the other eligibility criteria that fits into the waiver. There's certain pieces of it the opportunity to while it looks like it's service intervention completely identical. So if there's an opportunity to move into one funding stream allows for food and nutrition services.
No, I agree with that. And I think one of the things that we'll see more of is to be able to how innovative we need to be as we move forward with this waiver. I mean, this is before things are rolled out and so on.
Right. So there's certain pieces of it that
we're
while it
thinking
looks
and we're
like it's
projecting,
but I think
as we move on and we collaborate, this is an opportunity where seeing what other organizations are doing. No, I agree with that. And I think coming together with those organizations and having a plan forward will help as well. But also as we move forward with this waiver, I mean, new things that are going to emerge and new ways out of doing things. And so, not to add, I don't really have anything to add with what we're thinking and we're projecting. But I think as we move on and we collaborate, this is an opportunity and work together and think about what other organizations are doing that may serve the same population and coming together with those organizations and having a plan forward will help as well. But also as we are moving forward in the waiver, there are new things that are going to emerge and new ways of doing things. And so
we're building,
not to add,
right?
I don't really have anything to what to add with what Dorella said,
right?
but yeah, really thinking about thinking creatively. We have to think creatively and work together and think about what other organizations are doing and what lessons learned as we move on, like the first months of this waiver, what things may come to light.
And the reason that I keep underscoring certain parts of our conversation is because again, I think one of the themes that you said is that if any of you have right. So in some ways we're sort of building what you know is that as we're moving, 1,000%, right? Because it needs that people have our immediate and based in front of us. And but at the same time, know how we are anticipating and we're able to provide input as to what we think will allow this to be successful. Again, and the reason that I keep underscoring certain parts of our conversation is because organizations who not only understand the individuals, if any of you have understand your community, what you know is that I am 1,000%. And the other reason for that is that I want to underscore is that when we talk about outcomes, we're also talking about data. We would do right, and so data can be access. Data can at times be challenging. It takes resources to do it well. Effective a way as we have in New York State, the data if we did not have community-based organizations who not only understand the individuals that come through within your doors, but and those are lessons that I've learned through my public health journey too. That breaking it down as much as possible. The other reason for that maintaining the protection of the individuals who are being when we talk about outcomes, we're also talking about data is significant, right? And so data talk at all about data. Data can at times be challenging. The impact of data has to do it well to continue to advance and build on your service and portfolio on a local
level. Definitely. And it's so important when we think of data, thinking about both the quantitative, the surveys that we're doing, but also the qualitative that tells us the why we do this and the hows and the stories behind. So post-COVID, one of the things that we had done with our community-based organizations, a part of CTHE, is have listening sessions to understand what the needs were within our community. And then certain things came up really high on definitely. The list. Like mental health was an issue data thinking that needed to be addressed. We have quantitative surveys that some of the social determinants qualitative that tells us why we do this and the how, thinking about access to stories behind, access to housing, post-COVID, unemployment. Those needs done with our community-based organizations, a part of CTHEs, have listening sessions to understand what the needs were within our community. And then certain things came up really high members. So we've developed mental health. The Institute, for instance, we've developed a lot of mental health services that we've seen out into the communities with. We have trained youth so that they could provide about access to mental health, access to housing, support to their unemployment, those needs. And then when we thought about social determinants of health, we have gone into our beauty salons and barbershops. And one of the things that we have done traditionally is utilize that data to reach the same way you would go members. So we've developed the Institute, for instance, we've developed a lot of mental health. We have gone in. We have that system in the beauty salons and the barbershops. We have trained youth so that they could provide where people mental health people access this link. They get some information on health, and then they're able to assess and tell you what things they need, our beauty salons and barbershops, and then on the back end we have a community health worker, a navigator, navigate so the same way you would go into your doctor's office using the data, knowing that people need services and people may not want. We have gone in publicly. We have that system in the beauty salons and the barbershops, and to their barbers or stylists and say, okay, I need food, where people or I need housing, and so that's a way that they can get to services directly. But they're able to assess and tell you what things they need, what services they need, and then on the back end we have a community health navigate them to services. And so that's how we have used community data, getting information from the community and implementing it, and then assessing it also to make sure that I need this. They may not want to talk to their barbers or stylists and say, okay, I need food, for instance, or I need housing. And so that's a way that they can be linked to services directly. There's
many
a QR code that they could scan, get a resource guide, or they can be linked to an individual that would actually navigate them to services. And so that's how we have used community data, getting information from the community and implementing it, and then assessing it also to make sure
hospitalizations were there, how many emergency room visits were there, et cetera,
continuum
et
of
cetera.
care that they need.
So having this opportunity
in terms of
that
data,
the state is going to be working through the social care networks to be able to merge
both
have data on the services that they provide.
social service
The
services
along
complement
with
to that is
the data
baseline
that
understanding of
either
understanding or seeing the overall health of these Medicaid
managed
lives
care
is going to be
organization has in
transformative.
terms of.
But at the same time,
How many hospitalizations
you're going to have
were there?
all
How many
these
emergency
CBOs
room visits
potentially
were there? Et cetera, et
offering
cetera.
services that they have not offered before.
Having this
So it's
opportunity
important
that
for
the
them
state
to
is going to be working
monitor
through the social
data,
care networks to be able
understand
to
what data they're
merge
sharing with their social
both
care networks, and
social
then
service
working
supports,
together.
right?
And
Or
what's been
health-related social
really
service
revolutionary
needs
is the social care
services
network leads
along with
are
baseline
offering that
understanding of
clarity
understanding
by
or
choosing
seeing
the overall health
platforms
of these
that
Medicaid
are
lives
meeting
is going to be
the
transformative.
moment,
But at
meeting
the
the
same
understanding
time,
that not
you're
every
going to have all
CBO
of
is
these
built the
CBOs
same.
potentially
How do we
offering
make sure
services
that
they
data
have
is
not
going to
offered
be
before.
easily entered,
So it's
easily
important
received
for them
that?
to
Can those same
monitor
organizations work
the
with their social
data,
care networks
understand what
and
data
kind of
they're
say,
sharing
hey,
with their social
we're
care
noticing a
networks, and then
particular
working
population of
together.
people
And what's
is
been
demonstrating
really
like this.
revolutionary
I
is
think
the
that's
social
going to be
care
really
network
exciting.
leads are
The whole
are
upload to
offering
the
that clarity
shiny
by
and the whole
choosing
all of that
platforms
that's
that are
big
meeting
change.
the moment,
Meeting
and it's
the
a big change
understanding
happening
that
for
not
everyone
every
at the same
CBO is
time.
built the
So
same.
hopefully we'll
How do
all
we
have
make sure that
little
the data
grace
is
with
going
one
to be
another,
easily
but then
entered,
also
easily
try to strive
received back?
for
Can those same
gathering and
organizations work with their
maintaining
social care
the
networks
most
and
robust
kind of say,
information
hey,
possible
we're noticing a
to
particular
understand the
population of
impact
people
of all
is
of the services that
demonstrating
are
like
being provided.
this. I think that's going to be really exciting.
Dorella, can
But
you
the
reference the
whole
shiny?
upload to the
And
shiny and the whole all of that,
universe of
that's
data.
big change. And it's big change
So, yeah,
happening for everyone at the same
for
time.
anyone who may
So
not be
hopefully
familiar with
we'll
the
all
shiny,
have, a little grace with one
we
another,
have
but then
quite a bit
also
of
try to
laughs in the
strive
audience on that
for
one. But for someone
gathering
not
and
familiar with the shiny,
maintaining
so
the
there are a
most
number of
robust
ways in which
information possible
information and
to
demographic
understand the
information is
impact
collected
of
about
all of the
individuals.
services that are
The
being
intention,
provided.
of course, is to try to create, if you will,
Dorella, can
sort of a
you reference
seamless
the shiny?
I
a
did. I think it's the
seamless
shiny.
plan within
universe of
care
data.
for individuals, so that there's one space
So, yeah, so,
centralized
for
that is
anyone who may not be
collecting health
familiar with the
information,
shiny,
so it can be
someone-
used for the
we
purpose
have,
of
quite a bit of
maintaining
laughs
one,
in the audience on that one.
the
But for someone
integrity
not
of the
familiar with the
healthcare that's being
shiny,
offered
so
moving
there are a
forward,
number of ways in
and
which
to helping to sort of
information and
organize,
demographic
as you
information
can
is
imagine,
collected
for
about
any of us that
individuals.
have multiple
The intention, of
providers,
course, is to
if you're
try
not
to
within the same
create, if you
network,
will,
it
sort
can
of a
be very
seamless
confusing and challenging,
a
particularly in
seamless
getting people to
plan
communicate with one
within
another.
care for
So
individuals,
these
so
are
that there's
one
attempts that have been in
space,
motion for quite some time
centralized that is collecting
to
health
try to help
information,
centralize
so
that.
it can be used for
Which
the
is
purpose
another
of
part that I see
maintaining
is,
one.
again, another
uh,
responsibility of
the
building
integrity of the
trust that
healthcare that's
falls
being
to the
offered moving
community-based
forward,
organization,
and
because
two,
I'm
helping to
sure
sort of
that when
organize,
people are
as you can
advised
imagine, for any of
and
us
ask
that
for
have multiple
consent, to
providers,
be able to
if you're not within the
utilize
same
these types of
network, it can be
systems,
very
people want to
confusing
know,
and challenging,
what does that
particularly
mean?
in getting
Where is
people
my
to communicate
information,
with one
and who
another.
now will have access
So
to
these
it?
are attempts that have been in motion for
Absolutely.
quite some time.
And that's a
To
big
try
deal.
to help
That's a
centralize
big
that.
deal. Why are you
Which
going
is
to use
another
my
part
data this
that I
way?
see
What
as,
does it mean?
again,
And
another responsibility of
to
building
be able to
trust that falls to the
cite,
community-based
oh,
organization,
we
because
want to make
I'm
sure that the
sure
hospital
that
that you
when people are
go to
advised
when
and
you're staying at
ask
your
for
mother's
consent
home
to be able
has
to
the
utilize these
same
types of
details.
systems,
We want to
people
make
want
sure
to know,
that
what does
there's
that
no kind of
mean?
drop
Where is
in
my
any kind of
information,
service.
and who now will have
But
access to it?
it's a huge undertaking, and the thing to keep in
Absolutely.
mind with the
And
waiver,
that's a
yes,
big
it's all
deal.
of these
That's a big
community-based
deal. Why are you
organizations.
going
Yes,
to
it's
use my
managed
data
care
this way?
organizations.
What does it
sharing
mean?
their data
And
to be
but
able
there's
to
got to
cite,
also be this
oh,
warm
we
relationship
want to make
with all of
sure
the
that the
clinicians
hospital
out
that
there,
you
the hospitals
go
and the
to when
federally
you're
qualified
staying
health
at your
centers
mother's
and the
home
like
has the same
that's
details.
the other thing that the
We
social
want to
care
make sure
network
that
leads are
there's
helping
no
to
kind of
cultivate,
drop
but
in any kind
that
of
probably
service.
needs to also
But it's
get
a
stronger
huge undertaking
as part of
and
the
the thing to
whole,
keep in mind with the
success of
waiver.
the waiver.
Yes, it's all
Marilyn?
of these
Yeah,
community-based
I think the
organizations. Yes,
trust
it's managed
issue
care
is
organizations
so
sharing their
huge, because
data.
when we think about
But there's got to also
even
be this
though
warm
someone may
relationship with all of the
be
clinicians out
someone
there,
that
the
could
hospitals and the
utilize the
federally
waiver, waiver,
qualified health
they
centers
may have
and the
family
like.
members that may
And
be
that's
undocumented,
the other
right? Or
thing that
family
the social
members
care
that
network leads are
may
helping to
not want to
cultivate,
be in the
but
system.
that
And
probably
so
needs
when
to
you think
also
about data and
get
data
stronger
sharing,
as
Dorella, as
part
you
of the
talked
whole,
about it,
success of the
it's
waiver.
not just me,
Marilyn?
but thinking about, okay,
Yeah, I
if
think
I
the
give you
trust
information,
issue
does it
is
affect
so
someone else
huge
in my
because when we
family?
think
And do I
about
want to even give that information to
even
you?
though
Because I
someone
don't know
may
what the effects will be
that could utilize the
of it.
waiver.
So the trust
They
is
may
so
have family
important,
members
and the
that may
community-based
be
organizations,
undocumented,
you
right?
said,
Or
or family members
community-based
that
organizations being
may
on
not
the ground,
want to be
knowing
in the
people,
system.
and those
So when you
relationships
think about
that they've
data and
had
data
over
sharing,
the years
you
and
know,
they've
Dorella, as you
cultivated,
talked
those are
about
going
it,
to be so key.
it's not
at
just
this
me,
time
but
where
thinking
the
like,
waiver
okay,
is so
if I give
specific
you
about the
information, does it
population that's
affect
going to be
someone
served.
else in my family, and do I want to even give that information to
Absolutely.
you? Because I don't know
it-
what the
some
effects
of the
will be
questions we're
of it. So
receiving,
the trust
and
is so
it
important,
makes
and the
perfect sense as
community-based
people are trying to
organizations, as you said,
understand,
Joe, and the
you know,
community-based
what is
organizations
this?
being
How
on
do
the
I
ground,
potentially
knowing
become a
people,
part
and
of
those
this?
relationships
And
that they've had over the years and
where
they've
do I go to
cultivated,
find more
those are going to be
information?
so
So
key
there's a
at this
specific
time
question
where
from a
the
colleague
waiver
that
is
talks
so
about
specific
looking
about
for
the population
information
that's going to
specific
be
to
served.
nutrition education as part of a group class.
Absolutely.
And medically tailored meals and nutrition guidelines. Some of the questions we're receiving,
I recognize that this may be a little more detailed,
makes perfect sense as people are trying to understand. For a colleague, what is this? How do I potentially become a part of this? Promote, and I know we talked about outreach before, but where do I go to find more information? Services that are available. There's a specific question in this from a colleague that talks about looking for information specific to nutrition education as part of a group class.
So I could start by saying that
and nutrition guidelines.
the work of the waiver, the social care networks
recognize that this may
are
be a little more
doing such
detailed,
deep
but
work
in
with the
general,
Department of Health. So I
for
think
a
the Department of Health
colleague
is going
and
to have a
even for
big
the community
webinar.
as they're trying to
I think
understand
it's tomorrow,
how do
the
you
19th,
promote. I know we talked
talking about the
outreach
waiver
before, but how do your
and taking a
organizations
deep
promote the
dive
services that are
on
available? And in this question,
the
is there a specific
health-related
space that we
social
can
need
refer our colleague
interventions
to?
that they have selected for this phase
So
of
I
the
would-
waiver?
I
right?
could start by
Saying
saying
that
housing,
food and nutrition
the work
services,
of the waiver, the
social care
transportation,
networks
are
and
doing
such
workforce,
deep work with the
right?
Department of Health.
Innovation.
So I think the
So
Department of Health is going to have a
there's
big webinar.
a lot to
I
unpack
think
in the
it's
manual. I
tomorrow,
think
the
Edith
19th.
shared the
talking
manual.
about the
There's
waiver
this section of the website
and
the Department of Health
taking a
has.
deep dive.
So a lot of
on
robust information is there.
I think what is
health-related
important to
social need
understand is
interventions that they have selected
for this
there
phase
is going
of
to
the
be groups
waiver,
of people
right?
that will fall into
housing,
needing
food and nutrition
specific
services,
kinds of
transportation,
services under food and nutrition
and
services as an example.
workforce, right?
Innovation.
It's going to
So
probably be based on their ability
there's
to ambulate
a lot
on their
to
own.
unpack
Some of
in the
them
manual. I
may
think
not even
Edith
be enrolled for
shared
SNAP benefits.
the manual.
So there's
There's
an
this
opportunity
section
for
of the
that.
website.
There's all
the
of these
Department of
kinds
Health
of
has.
categories.
So a
of
lot of robust
supporting
information
an
is there.
individual.
I
So I
what
think
is
that's
important
the
to
thing
understand
to really
is kind of step back and take a look at.
There's going to be groups of people
if there are
that
certain
will
diagnoses,
fall
in fact,
into
needing
a pregnant population
specific
is going to
kinds of
be able to
services
receive
under food and nutrition
meals
services as an example.
home delivered,
Right?
but
It's
maybe
going
this
to
person is
probably
like,
be
I don't
based on their
necessarily
ability to
want home
ambulate
delivered.
on their
I
own.
want
Some of
something
them
that I can
may
cook
not
for
even be
myself
enrolled for
because
SNAP
I've got that
benefits,
kind
so
of
there's
an opportunity for
then
that.
that's
There's
fine.
all
They
of
can
these
totally
kinds of categories
navigate
of
through that
supporting
with
an
the
individual.
navigator from the social
So
care
I
network.
think that's
So I think there's
the
going to be
thing
these
to
exciting
really
kind of
step back and
iterations,
take a
and
look
as
at.
people hopefully
Because
improve in
if there
their
are certain
health,
diagnoses,
if that's
in fact,
the
a
phenomenon
pregnant
that
population
is being
is
addressed,
going to be able
then
to
it's
receive,
going to be that you see them
meals,
graduate to
home
fresh
delivered,
groceries,
but maybe this
pantry,
person is like, I don't
et cetera,
necessarily
vouchers,
want home
etc.
delivered.
And
I
that's
want something that I can
transformative.
cook
And
for myself.
that's where the
because
data
I've
is
got
going to
that kind of a
show
family.
then
the
that's
success
fine.
of
They can
the
totally
waiver itself.
navigate through that with the
and if
navigator from the social care
that person
network.
could reach
So I
out
think
to
there's
us
going to be these
directly
exciting
for the
kind of
food specific
iterations, and
information
as
if they
people
need that.
hopefully
Some of the
improve
work
in
that
their
we're
health,
doing
if
in
that's
terms
the
of
phenomenon
educating
that
folks
is being
about
addressed,
nutrition,
then it's going to be
exercise,
that
and
you
those
see them
kinds of things.
graduate
But
to
also, we
fresh
on the
groceries,
website,
pantry,
our
et
CTHE
cetera,
Communities
vouchers,
Together for
etc.
Health
And that's
Equity. It's
transformative, and that's where the
CTHE.us,
data is
and
going to
we have a
show
lot of
the
social
success
determinants
of
health
the waiver itself.
information there, and we have organizations that are focused on
reach out
social
to us
determinants
directly
of health. So
for the
all the
food
different
specific
services,
information
social
if
services
they
that may be
need that.
needed.
Some of the work
So
that we're
that's a
doing
website
in
that
terms of educating folks
to
about
go to.
nutrition, exercise, and those kinds
That's
of
great.
things. But
A
also, we
few more
on the
specific
website,
questions that are
our
coming in, and I
CTHE
recognize that we have
Communities
4
Together
minutes
for Health
left to our
Equity.
time.
It's
Time goes fast.
CTHE.us, and we
One of our
have a
colleagues has
lot of the
asked,
social
is a
determinants of health information there,
MLTC
and we
or
have
Managed Long-Term
organizations that
Care organization
are focused
eligible
on
for the
social
Social
determinants
Care
of health.
Network
So
program?
all the different services,
So,
social services
Darrell,
that
I
may
saw
be
you laugh.
needed,
I'm happy
so
to,
that to jump in, but I didn't know if you had wanted to say something.
To go to.
No, I saw the question,
great.
and I think
a few more specific questions that are coming in, and I recognize that we have 4 minutes
managed
left
long-term
to our
care
time. Time goes
individuals
fast.
are not folded into the waiver
One of our colleagues
intervention.
has asked, is
I believe it is all other kind of
MLTC or
categories of
long-term care
Medicaid,
organization
and
eligible
perhaps
for
the
the social
reason
care
that
network
it's not
program?
managed long-term care.
So
It
Dorella, I
might
saw
be
you
for
laugh.
certain
I'm happy
services.
to,
So, for example,
jump in, but
managed
I didn't know
long-term
if you
care
wanted
does
to say
not
something.
have
No, I saw
covered benefit
question,
for housing
and I
connection.
think
So it might be that they're able to
I
be
believe
part of that
managed
service.
long-term care
They
individuals
might
are
be able to
not
be
folded
folded
into the waiver
transportation.
intervention.
The reason,
I
perhaps,
believe it is
for
all other kind of
either clinically appropriate
categories
meals
of
or medically tailored
Medicaid,
meals,
managed
and
long-term
perhaps
care
the
will not
reason
be
that it's not
included
managed
there
long-term
because
care,
it's a covered benefit
might
under
be for
managed
certain
long-term care.
services. So, for
already.
example, managed long-term
So
care
that may be
does
the only
not
kind of distinction.
So it's
have
going to be
a
important
covered
for
benefit
whoever's asking
for
the question
housing
to pay
connection.
attention to
So it
both
might
the
be that
manual
they're
and the
able
website
to
that could
be
be
part of that shared,
service.
and then
They might
that's
be able
my
to be
2
part
cents
of
there.
transportation.
Okay.
The
And
reason,
so one of
perhaps,
the things I did
for
just put in is
either clinically
the
appropriate
chat
meals or
is a
medically
link
tailored meals,
that goes directly
managed
to the
long-term care
Department of
will
Health
not
website
be
and specific
included
to
there
social care
because
networks.
it's a covered
I
benefit
think the
under
question of
managed long-term
eligibility
care already.
is, first of all,
So that may be the
an
only
important
kind of
question,
distinction.
but
So it's
second
going
of
to be
all, is
important
best
for
answered
whoever's
on
asking
the
the
many
question to pay
FAQs, or
attention
frequently asked
to
question
both the
documents
manual
that
and
are
the website that
available
Kavitha
on this
shared,
site.
and then
And so, and
that's
also
my 2
certainly
cents
feel
there.
free to reach out to me
Okay.
if there are specific
And so
questions
one of the things
as to
I
the
did just
services
put
that
in
you
is
provide.
the chat
And
is a link
happy
that
to
goes
do
directly to
further
the Department
diligence
of Health
on that.
website
And specific to social care
you know,
networks.
we've talked about many of
I
the
think the question of
resources,
eligibility
we have
is
the guide,
first of all,
which I referenced at the
an
beginning,
important question
of
but
our
second of all, is
conversation
best
that
answered
certainly
on
can
the
provide
many
significant
FAQs, or
information
frequently
related
asked
to
question documents
community-based
that are
organizations
available
and their involvement.
on this site.
Again, I
And
just
so,
placed
and
in the
also
chat the Department
certainly
of
feel
Health
free to
website
reach
that
out to me
speaks
if there are
specifically to the
specific
social care
questions as to
networks,
the
the
services that you
eligibility,
provide,
the framework, and the
happy
intention.
to do
And
further
I
diligence on
just
that.
want to, in our final minute, just
sort
of
we've talked about many
some
of the words that I heard throughout our entire
we have the
conversation
guide,
this
which I
past
referenced
hour.
at the beginning,
And
of our
certainly we
conversation
understand that the
certainly
1115
can
waiver
provide
is
significant
intended
information
to
related to community-based
advance
organizations
health
and their
equity,
involvement.
address
Again, I
and
just placed in the chat
eliminate
the Department of Health website that speaks
disparities
specifically to the social
by
care networks,
making
the
sure that we're
eligibility,
providing access
the
to the social
framework, and the
determinants of health.
intention. And
Words
I
such as
just want
coordination,
to, in our final
leverage,
minute, just sort of
supplement,
underscore some of the words that I
innovation,
heard throughout our
network,
entire
and
conversation
complement
this past hour
were used throughout
and
our
certainly
discussion.
we understand that
And I'm
the
so
1115
grateful
waiver
to
is
both of
intended
you for
to
taking the time
today to help us
advance
understand
health equity,
and underscore the
address
essential role that
and
community-based
eliminate
organizations
the
serve and play
disparities
within the 1115 waiver,
making sure that we're
and the
providing
encouragement
access
to
the
others
social
who may
determinants
have
of
had the
health.
opportunity to hear today
Words such as
the benefits that they too
leverage,
can bring forward
supplement,
in their work.
innovation,
So my thanks to you,
network,
and I
and
will turn it to
complement
Kavitha to
were
close us.
used throughout our discussion.
Thank you so much,
And
Johanne,
I'm so
Marilyn, and
grateful
Dorella. This
to
was a
both
really
of you
dynamic
for taking the
discussion.
time
I was
today
like
to help us
shaking my head. You
understand
couldn't
and
see too well, but it
underscore
was like a lot
the
of
essential role
very,
that
very
community-based
important points, and we are
organizations
so
serve
excited
and
we were
play
able to bring you all together
within the
today.
1115
And for
waiver,
everybody on the
and the
call, we are going to
encouragement to
follow
others
up
who may
with the
have had
webinar
the
recording,
opportunity
and
to
we'll
hear
make sure to
today
include all the
the
links and
benefits
the
that they
resources that was
too can bring
discussed here.
forward in their
So
work.
definitely look out
So
for
my
that in the
thanks to
next
you,
few days.
and I will
And
turn it to
lastly, if you are
Kavitha to
interested in
close
learning
us.
more about Blooming Health, thank you so much, Johanne, Marilyn, and Dorella. This was a really dynamic discussion in the new year, shaking my head. You couldn't see too well, but it was like a lot of very, very important points, and we are so excited to launch. We were able to bring you all together today. And for everybody on the call, thank you. We are going to follow up with the webinar recording, and we'll make sure to include all the links and the resources that was discussed here. That we've been so definitely look out for that in the next few days. Thank you once again for taking the time to join us. If you are interested in learning more about season and everybody's getting ready, so appreciate you being here. Excited to so today's webinar is focused on maximizing impact. Until then, everybody have really happy holidays and looking forward to the launch. We have an amazing panel and host here who's going to walk us through this discussion topic in a few minutes. So the agenda for today, we're going to get started with a brief introduction on who we are at Blooming Health. And I'm Kavitha Nyanasam.